Good morning, everyone. Today I am here to present the code of ethics in nursing. So, what do you mean by the code of ethics? First one, ethics comes from the Greek word ethos, meaning custom or guiding in beliefs. In 1953, ICN means International Council of Nurses adopted the Code of Ethics in Nursing. ICN Code of Ethics for Nurses first adopted in 1953. ICN means International Council of Nurses. Then recent ICN Code of Ethics for Nurses launched in the year 2021. The purposes of Code of Ethics. First one is the guidance for decision making, means it helps the nurse to make their decision choices in complex situation. Then number 2 is the defines professional standards, means establishes the nurses ethical values, responsibilities, roles in profession. Then patient advocacy means guides nurses to protect their rights and promote health equitability. Then support nurses. Number 4 is support nurses, means it helps the nurses maintain their integrity and cope with moral. Then last one is the builds trust, means builds trust between nurses, patient and the public. This is the purposes of code of ethics. Being fair to all your patients, then beneficence means doing only good to your patients, and non-maleficence means doing no harm to your patients. Then fidelity means keeping one's promises. Then autonomy means letting the patient there. Last one is the veracity. Veracity means being completely truthful to your patient. This is the all principles of code of ethics. Without these principles, as an ethical nurse, is not possible to be an ideal ethical nurse. Qualities of a ethical nurse. First one is the moral integrity. Moral integrity means the qualities of a person with moral integrity include honesty, respect, truthfulness, trustworthiness, and wisdom, and the courage and respect to all your patients. This is the moral integrity. And second one is the honesty and truthfulness. The nurse should always respect themselves and must be honest with clients. Then moral courage. Moral courage means the core values associated with moral courage include honesty, truthfulness, respect, and the compassion. Then advocacy. Advocacy means speaking up for the patient's rights and safety. Then justice means treating all patients with fairly. This is the qualities of a ethical nurse or ideal ethical nurse. The Code of Ethics, ICN, International Council of Nurses, there has a fourfold of Code of Ethics. First one is the nurses and people, means nurses and people means those people who are required for the nursing care. First one is the responsibility of nurses and people is nursing services. Nursing services, according to priority, nursing services must be provided to the patient or clients. Then respect beliefs and values. Respect belief and values means the nurse should always respect the beliefs and values of the patient. The nurse holds in confidence personal information and use judgment in sharing the personal information of the patient. Then number 2 is the nurses and practice. In nurses and practice, practice means how you will provide nursing care to the patient. First one is the maintain nursing care. How you will maintain the nursing care? Maintaining nursing care to the patient means providing nursing care consistently. It doesn't mean giving nursing care one day and that is not giving in the next day. So that has to be maintained in every day. Then rise professional dignity. It means that when providing nursing care to the patient, it should be always maintained in a proper way. That doesn't mean it patient I am providing the nursing care to the patient and the patient will give me money in return. If you do this, you will not be able to elevate the profession to a higher level and will not gain respect. If you rise your dignity, then you will maintain in a proper way of nursing care to the patient. And number 3 is nurses and the society. Nurses and the society means take personal initiation and support the health. Means the nurse must personally participate in the work that the nurse will do for the society. Then the nurse of the society is to explain what is health and through health education they can explain to everyone in society how to stay healthy and how to maintain a healthy lifestyle. In point is nurses and co-workers. The nurse maintain a cooperative relationship with co-workers and the other field. Last one is the number 5 is nurses and the profession. Means nurse play important role is in rising the dignity of nursing practice. Dignity must be maintained while providing nursing care or to the patient or providing nursing work to the society or the clients. Thank you.